finance and then just see, you might end up in LILLY China if that's where you want to be, you know. So you can filter it a couple of different ways that fit for whatever your needs are as far as what you're looking for.
Nice. Well, that's great. So we do have one of our students, Nolan, has asked the question, did you all have science or medical backgrounds prior to starting your careers at LILLY? So that's a great question specifically for the UConn alum. So fill us in, tell us all about it.
So I think it's a big misconception. I think a lot of people think that if you're going into pharma, you have to have this big science background. And that's not the case. So I actually was a communications major when I was at UConn, specializing specifically with like market research and statistics and stuff like that. So not even in the same ballpark as what you would associate with like a typical background for pharma. But I think what's great is that LILLY has a great like system or protocol in terms of onboarding new individuals. So you go through a pretty extensive training. So not only do they teach you how to sell the products and have these conversations with providers, but they actually give you the tools and the background of the actual disease state that you're working in, understanding on like a scientific level what the medication is, what it's doing, what the actual disease state you're working in. So like honestly, I can say that I feel super confident when I'm talking about diabetes in front of my customers, because for full transparency, I was very nervous. I'm like, how am I going to convince this doctor who's had like decades of experience within their own practice, plus all of this medical education? How am I equipped to be able to talk to them on a level that they're, you know, doing on a day-to-day basis? And honestly, like I can say almost 5 years now into the role that I've become kind of an expert within diabetes and being able to have very technical conversations, you know, and didn't come in with that, you know, particular advantage of having a science background. So don't be intimidated by it, because LILLY, even if it's the internship, even if it's full-time roles, they do a huge training, you know, to get you ramped up and make sure that you're set up for success. So science is not a requirement.
So just to kind of piggyback on that just a little bit. So then how did you craft either your, let's just say your resume for a position within sales within pharmaceuticals, right? So it would seem to me, as Nolan indicated, it would seem to me personally that there would have to be a little bit of a science or a technology background that would transfer. So what was your selling point on your resume that brought you in and caught the eye?
Yeah, so again, just to kind of reiterate, you don't have to have the science. We look more for the specific quality. So being a self-motivator, being someone who, you know, it's almost like running your own business as a sales rep in the field, whether it's an intern or a full-time role. So you have to have really good like organizational skills. You have to be very driven. You have to, you know, be willing to be, you know, out of your comfort zone a little bit. I mean, you are talking to a variety of different people, whether it's the nurse, whether it's the receptionist, whether it's, you know, the actual doctor, you know, so you have to be able to kind of adapt. So I think when we're looking at potential candidates, again, whether it's for the internship or the full-time opportunities that we have, I think we look more for the personality traits of what makes a good sales rep, and not necessarily, you know, having the technical knowledge, because you can have all of that, but if you're not able to communicate that in a way that's conversational, or, you know, you're discovering kind of where that provider is, you're going to struggle in the role. So I think, you know, it's more important to have the right kind of attitude and the right kind of, you know, in terms of, you know, like I said, being adaptive, being, you know, a self-starter, being motivated. I think those would rank higher in terms of some of the skills that would make you stand out. Obviously, not to say if you don't have, you know, if you do have the science background, or if you've had, you know, those, that's great. That's just going to help you transition into the role quicker. I know for me personally, I, you know, did some internships when I was at school that allowed me to be in leadership roles. I was an RA on campus, and I was involved in the RA advisory board. You know, so I really looked for opportunities that allowed me to show some leadership on campus. And then post graduation, I actually did 2 years with inside sales too. So I think, just if that is something that you're really interested in, kind of building your resume around leadership opportunities. If you have any internship experience with like sales or inside sales, or communicating over a variety of different like sleeves or jobs or departments, I think are all really great skills that'll help you kind of be able to distinguish yourself against some other people potentially who are also looking at the role. I don't know if that answers the question per se, but
Oh, it definitely does. Definitely does. Yolanda or Eliza, either one of you have anything that you'd like to share regarding that? I also, my canned question was going to be really about what are the desired skills, but Rachel went ahead and gave us a very
Yep.
broad outline. But if there's additional information either one of you would like to share, I'd love to hear it.
No, I agree with Rachel. I mean, it's really it's all about the skill set. Even though I did have a science background, there's many people that I work with that have many different backgrounds, from social work to, it could be finance, it could be anything. But what Rachel really hit home is the fact that we look for the certain skill set. Are you a self motivator? Are you going to be the one that's going to get up in the mornings and really just motivate yourself, at the same time be an asset to the team? So we're more of it's a very family oriented company. And the best thing about Lilly is the fact that once you're on board, we're not here to make anyone fail. We're going to make you a family. And that's what it truly is. That's what it is. And for me, coming from other companies, I've been with Lilly for 7 years. I have to say that this is one of the best companies that I've ever worked for.
Well, that's the testimony right there.
That's
and your spouse works there.
It's a family affair.
Welcome and welcome home, I should say, right? So now you're back here in Connecticut. So am I right?
Yes.
Okay. Yes. So welcome home. Yes. I'm sure.
I'm happy. I'm originally from New York, so we moved to Connecticut. Perfect. So yeah. No, it's a great company. Yeah.
Great.
Yeah, and I agree 100% with Eliza. I myself also have worked for other pharma companies, and Lilly is by far the best corporate culture that I've worked for. And as far as what we're looking for, one of the main thing my Rachel's manager said was someone that has the entrepreneurial spirit, because you have to be a self-motivator. And he said that they're always looking for someone that's going to do the right thing when no one is looking. Because you want to make sure that someone's going to be on the team. And like Rachel said, no one's going to tell you to get up in the morning and go to work. There's no office you're going to be checking into every day that you have to show up. If you're not a self-starter, this is not, at least as far as the sales go, this is not the industry for you, because we're here for you to, look at your book of business and go out there and get the business.
Excellent.
And I think too, like, problem solving is such a big thing in this role too. Just being kind of critical in how you analyze your business and being able to look at it and say, okay, this is where I need to focus more, or hey, this is what I've been doing, it's not really working because this is what the data is showing. So how can I kind of adapt my messaging, to help get across this, where I can get the provider to switch their behavior and kind of write, Lilly products. But I think too, like, we're really focused on patients too, and being able to do the right thing, and kind of having that mentality as well, I think is important. So
well, thank you. I'm going to jump into the interview process just a little bit. So I'm wondering, maybe you could give me an overview of what the interview process looks like. How students are vetted, and do you use LinkedIn, applicant tracking systems? Do you do video interviews? The whole gamut. Whatever you're willing to share, we are definitely willing to hear about at this point in time. I
actually interviewed my my manager to get ready for this for Career Tuesdays, and currently all of the interviewing they're doing is virtual.
Okay.
In the future, we will be going back to in person. So there is a recruiting company that does all of the screenings. So that's an external person that they work with that actually, gets all of the applications, and they work with our HR department to screen the candidates. And the ones that, make it through that screen then gets passed on to the manager that is looking to fill a position. And you're interviewed, you have a phone screen based on, the recruiter. Then you'll be put into a live interview process after the phone screen, and you interview with two DSMs, usually whether it's virtually or in person. And then if you are the one they want for that position, HR is the one that notifies you with an offer.
Interesting. Interesting. Bing, bang, boom, done. Right?
Yes.
Do you, obviously because of the virtual environment that we're in, students are very, 2 years ago, we were just barely talking about applicant tracking systems, but more and more recruiters are talking to us about the applicant tracking systems, not so much as trying to boot people out of the system as to whether or not their resume passes muster, but really utilizing it more of just that, a tracking system. So do your external recruiting agency, are they using an applicant tracking system? Do they use LinkedIn at all for recruiting?
I honestly don't know the answer to that, but I can find out and get back to you.
Well, that's okay. I just think, you know what? I just think that seems to be a question that students are asking more and more, right? That we don't have that opportunity to interact in the atrium at the School of Business and to collect personally somebody's resume. So, we talk to students about the applicant tracking system, that it's not just a tool, because I think originally when people talked about, or recruiters were talking about tracking systems, it was primarily, I'm sorry to say it this way, but in perhaps a negative environment, right? That it was not providing students with the opportunity to go ahead and tell their full story, because maybe they were doing a keyword search and they didn't get it to the next level. But really what I think most recruiters are trying to share now is that it is a tracking system. It doesn't say, well, nope, Yolanda, you're not in the system. We're going to boot you out because you didn't have 5 keywords that matched. It's more of just being able to follow the process of you applying and what the next steps are, right? So, and that system providing those prompts and that responses. So
I will find out, and I will follow up with you or Mick and get the answer on whether or not they're using it.
Sure, that would be great. That's great information. So I know that we've kind of covered this overarching and talked a little bit about, the details of your employment, but can you give us maybe what a day is like for each of you, within your current positions and what it looks like? So, or perhaps what it was, Rachel, for you as an entry-level individual. What did a day look like for you, and how did you move forward with that?
Yeah, so I think since we're all in the sales role, I think our days look pretty similar, in the sense that I make sure that I sync my system, that we track all of our activities, signatures, data, and everything like that, because that's really going to make sure that everything's up to date and also help me kind of game plan for the day. I mean, I already have my what we call routing set up, meaning I know, who I'm going to see that day, so I have that in mind. But LILLY has a bunch of different tools that allows us to kind of analyze our book of business. So I'll look at different reports to see, prescribing habits for providers that I'm seeing that day. That's just going to help me have a more targeted conversation with them whenever I go into the office. Now that we're working from home, or working in kind of a hybrid model because of this pandemic that has just kind of thrown everything for a loop, I still do the same, you know, what we call pre-call planning, which goes through those reports before I call an office. But a lot of offices now I call over the phone, and I speak to the receptionist, or I speak to nurses, basically anyone who interacts with a patient when they're in the office, and have conversations around, you know, the medications, efficacy, resources that we have available that can help a patient kind of ease their transition onto new therapy. And also prepare for a conversation with the provider, whether it's, you know, 15-second quick, like, hey, here's my one line data point, or, you know, if I have a meeting set up with them where I have a little bit more time and can actually engage in a conversation and ask a little bit more questions. You know, so whether I'm in the field or on the phone, that's kind of similar to my approach. I do schedule like appointments with offices. So for example, today I actually had what we call a program where we actually get, you know, another provider who is, you know, a specialty, you know, specialist in their field. So in this case, an endocrinologist, talk to an office about one of our medications, answer questions a little bit more in depth than I would be able to, because they actually practice and can kind of lean on their personal experience with patients and the medication. I do lunches or breakfasts where I basically work with the staff, and sit in office when we were still going in office, and do a kind of what we call lunch and learn, where we talk about the medication, where it might be a fit for their practice, troubleshoot if there's any issues. And then also following up with like resources, like I said. So sometimes I'll send some copay cards, or like one page, you know, reference, you know, whether it's about payer access or, you know, things like that. So that's kind of the makeup of the day. I mean, when I was in the field, I would see anywhere between 8 to 10 offices, and varying depending on how big the practice was. And now virtually, you know, it's just same thing, just, you know, over a Zoom call, or over a phone call, and just whatever to kind of get in touch with the office. So that's pretty typical. I don't know if you guys want to add anything.
Actually, Rachel, I wanted to ask you, you know, thank you so much for that in-depth, you know, overview of what that day-to-day sort of looks like, but also to that note, how far is that territory for you as well, you know, as far as your service that you provide?
That's a really great question. And I think that's like the $1 million question too. I think it depends on what business unit you're supporting. It depends on what specialty within that business unit. For example, diabetes has a couple of different sleeves or specialties. You know, so I think it just depends. So for example, when I first started with LILLY, I was covering our Stanford territory, which is really just kind of like Fairfield County, a little bit of Litchfield County. And now it's kind of evolved through, you know, just different realignments of geography and stuff. So now I actually overlap 2 different territories. So I'll cover western half of Connecticut now. So it's grown since I've been with LILLY, but that hasn't been the case for everybody. So it really just depends. I mean, I think, you know, obviously you get your book of business for the quarter where they have a list of providers in your assigned zip codes. And what's great is we really have the flexibility to kind of design what our business is going to look like. So, you know, there are times where there's customers where maybe I don't have access, and I'd rather spend more time with this provider because I know that I can actually go into this office and make an impact. So you do get the flexibility to kind of adjust. But in terms of geography, it really just depends on the specific area that you've been hired for.
Thank you.
Lisa probably should share, because both Rachel and I are on the same team, and we're primary care, calling on primary care doctors, whereas Lisa's territory is totally different.
Do share. We want to hear.
So, is it more global?
So I'm in the senior care division. So I call on nursing homes, and I also call on specialty pharmacy. Now, my geography is the whole state of Connecticut. So you can imagine that's where the business planning come into play, because there's over 200 to 300 nursing homes. I can't go to every last one of them, but what I do know, and the information and all the business tools that LILLY gives me, I'm able to decipher and look through it and understand where can I get most of the business from. So that's where, you know, when you think about a day-to-day, I think of it more as a week-to-week, because the beginning of that Sunday, I have to know where my plan is or where I'm planning to go from that Monday, Tuesday, Wednesday, Thursday, Friday. So that aspect of it, planning is key. And that's one of the things that it's an attribute that you have to have, that self-discipline, to make sure that you're able to understand, just like what Yolanda said, no one is going to wake you up. You have to wake yourself up, and you have to figure out where you're going to go that day. So for my territory, yeah, it's definitely larger. It's more of account based. So just like I said, I always have to tie in the long-term care facilities, the physicians, and also the specialty pharmacy. So it takes a lot to connect all the dots there. So that's the difference when it comes to the senior care division. And again, Lilly has like at least six different sales divisions. So we're diabetes, but we just, like I said, we have oncology, we have neuroscience, we have a whole lot. So.
So that's interesting. And Nolan just asked another question about, do you have a business rotational trainee program or something similar? So my thought process immediately went to, all the different sleeves, as you would call them. So, how do you, and Rachel, you touched on this early on, how do you make that decision, of what area you really want to be in? So do you have something similar to a rotational program that targets college students or recent grads?
No, we don't have well, that's an interesting question. And the reason why, because we do have certain projects within Lilly, like we have the Marketing Academy, which is specific for the marketing department. But as far as sales go, on the sales side, usually you just look to see what's open and apply for that job, and that's how you get it. Like I came in to Lilly on the neuroscience division. So I originally started off calling on accounts, going and talking to psychiatry, and then as products change and their life cycle ends, opportunities shift, and I had the opportunity to move over to the diabetes division in order to keep a job. And so I came to primary care because that was what was available at the time. So they give you warning. So it comes down to what is going on in the company, and what their needs are determines what is available and what's open. And also depending on what's going on in your life. Like Elisa said, I met Elisa originally when she was a primary care rep with me on the team in Stanford. She moved out to Indy as a specialty rep, and now she's back as a senior care. So she's changed sleeves several times. So, you can look to see what opportunities are available, but usually you come in with one job. And then after, spending a couple of years in that one, you can kind of see what else is out there.
And I know too, like with the internship, they're based out of where that student calls home. So we keep it local. So in terms of the actual internship, it's not like, they need to relocate or anything, with that regard. They actually do it wherever, geography they fall in for a territory is where they would actually, be assigned. And then in terms of full-time opportunity, I know we also had a GeoFlex position. So sometimes people would get hired in as GeoFlex, and basically because of the nature of that role, you may, find yourself hopping to different, territories where they find need until, there's a full-time position. So if someone goes on leave, or there's a vacancy in a role, or for whatever reason, I know that was going on. And then, that's the intention of getting hired in full-time into one specific territory. So that's really the only time I would hear of someone full-time, maybe jumping around or rotating or whatever. So.
Thank you. So Yolanda, you mentioned this earlier about this for this summer that you hired a UConn student. So let's talk a little bit about this. Is it going to be a virtual position, a virtual internship?
This summer it is. They had to, usually the summer internship is a sales job. It's exactly the same job we do, as Rachel was just saying, is where the student live. And we've actually had several students from UConn be sales interns, where they get trained on one of the products in diabetes or in neuroscience, depending on which division they accept the internship in. They get trained on one product. They get a territory list based on where they live. They get a car. They get a company credit card and computer, and they actually go out and do our job in a smaller scale for 10 weeks during the summer. They get a week of training at home and a week of training out in Indy, and then they're also partnered with a mentor, so they're not out there totally by themselves, but they actually get to see as an intern what it's really like to do the job. It's not one of those internships where you go get coffee. You're actually working.
Sure.
One of the first interns we got from UConn, she actually ended up being my partner. So I like to say it's a 10-week job interview because it's a really great opportunity for you to see, for the student to see if this is the industry for them, and for the company to assess the abilities, because we've hired some and we've not hired some.
Sure.
And then
so
last
it's not,
summer, go ahead.
No, I was just going to say, so it is a pipeline, obviously.
Yes, it
Right.
is. And last summer's intern, unfortunately, did not get an offer. They had to redo the whole internship last summer because originally they were supposed to be in the field, but it became virtual and they had to revamp how they were doing it. And this year's internship class is also virtual because they're not, sure how things are going to go. And as Rachel said, like right now we're in a hybrid position where like I just got cleared to go into the field last week, so like yesterday was my first day actually out of my house.
Yay!
It's 6 months, whereas Rachel's still stuck at home. So,
I'm still making phone calls and doing everything.
and Lisa's still stuck at home.
All the people.
I keep my fingers crossed every Thursday for that email.
I did just have a conversation with another recruiter who said, well, in sales as well, and was super thrilled that they have now been allowed to travel. So I get it. I understand, right? So, yes. Well, Nolan, do you have any other questions? Anything that you, in the spirit of time, Mick, anybody questions that you'd like to put forth? I think that this is a great wealth of information. Anything that any of you three want to make sure that you add, please feel free. My questions are complete, but I can always come up with more, but I want to make sure that I provide the opportunity for other folks to go ahead and chime in.
I don't that's coming to mind right now. I appreciate all of you taking the time to speak with us, though.
Oh, there you go.
Yeah, I guess for just my final question, sorry, Sue, there, as far as, we're focusing really on the sales side here, but also students, that might be interested in looking at those career opportunities that would be more with corporate, whether it's marketing and finance, for ways for them to engage and get involved in finding out about those roles. Would it simply just going to Lilly Pharma's website under careers and searching for those opportunities?
Yes. I mean, that is the quickest way to see what's available, and I know that they're always looking. I would like to put out there that, like I said, our headquarters is in Indianapolis, so I know because of the pandemic they have transitioned some jobs where you can do them remotely, but I know that the goal from talking to our manager is for people to come back to Indy. So they have to keep that in mind, that there may be some situations where you may be able to do some things remotely, but you will still have to be at Indy at some point in time in the career.
Got it.
If you want to
so much.
It's not a bad place.
It's not.
Absolutely not.
It's a big, small city. That's what I like to say.
Yes, it is.
Yes. Yes.
Great qualities.
If someone is interested in the other positions, like I said, we do have research, we do have marketing, we have finance, we have legal, we have advocacy. There's a whole big world out there with Lilly, and even if sales isn't your ultimate goal, you can come in as a sales rep and then parlay it into something else. I know someone that I went to training with that's now in corporate legal affairs because she was a rep in DC and got involved with Lilly advocacy in DC, going to Congress, and a position opened up in corporate that she found that she enjoyed it. So sales is a really great way to really understand that you're the face of the company and get a different viewpoint from once you go. Because I, just to tell a quick story, I had someone from finance ride with me last year, right before we all went on lockdown. She went straight into finance from Lilly right out of college. She enjoyed it, but she was coming to Connecticut because we have a partnership with BI, which is located down in Ridgefield, and for a meeting, and she wanted to ride with a rep for the day. And I volunteered. By the end of the day, she wanted to be a rep because she had never seen that side of things. She didn't understand that when she's looking at a budget and making cuts or making decisions, the impact it had on the field and what we could do. So by the end of the day, and spending the day with me and interacting with my doctors, doing a lunch with me, she got to see, like, when we are asking for more money to do something, this is why, and this is why it matters. And she really enjoyed herself. I mean, I made it look easy because I've been doing it forever, but it was just one of those things where just because sales may not be where you want to be, it's a really great opportunity to understand the business in a different way.
Absolutely. It's so valuable working for a company with over 30,000 employees, a multi-billion-dollar firm. There's plethora of opportunities for students or I should say recent new hires to be aware of that. You're not necessarily always going to be just in sales if you don't want to be that. There are other options and avenues for you. And that's fantastic, the kind of value that Lilly has to offer to its employees.
I choose sales because I enjoy what I do every day. I love knowing that that's what I would like for people. I actually, I've been a rep for 20 years, and I actually enjoy what I do most days. So every day is not the same, but most days I enjoy it, and I enjoy the impact I have when I go into a doctor's office and they tell me that a patient that they started on one of our medicine got their numbers controlled. Or if they're looking at a patient's chart and they're, like yesterday, I did lunch with an office, and the PA they just had a folder come in, and it was a patient, and they were talking about this patient who was not well controlled in her diabetes and wasn't compliant. And it just so happens we have a medication that would help make the patient a little more compliant. And in talking with him about that one patient, he walked away and said, you know what, I'm gonna try her on your medication, because he was looking for something that was going to get her numbers down, but also help her stay compliant. And that made me feel good because I found a solution to a problem he was having with a difficult patient.
Sure.
It makes me feel good.
Yolanda, just to go off that real quick too, I think that's what really has made me love working at Lilly, is that, I mean, we're not a typical sales role in the sense that, all right, at the end of the day, I need to get 20 scripts from this doctor. I don't care who they're giving my medication to, but if they're writing, I'm fine and I'm happy. No, I have had conversations where I've had to tell a provider, I'm so excited that you're excited about my medication, but unfortunately for this specific patient that you want to use it for, that's not a fit. And Lilly really supports you in doing the right thing. It's yes, at the end of the day, we're sales and we have, quotas, we have numbers we need to hit, but integrity is really important. And I mean, we look for that in the people that we look to hire as well, because those are our values. And really, we are here to help, improve patient outcomes, and to help, providers get their patients there. So that's something that I carry with me every day when I, start my day, is I think about my family members who are affected by diabetes. And I said, you know what, I really want that doctor to know what options are available and to make the best decision because it's a good fit, not because there's someone, just trying to fill a quota or whatever. So, that really gets me motivated and excited about working every day. So
yeah, I have to agree with Rachel. We are very big in integrity. We're a very conservative company. And the big thing about us is the fact that, just like what Rachel said, if that medication does not fit that patient, put them on something else, because you know what it is. It's our reputation. And we want to be a value. We want to be a consultant. We're partnering in these offices. So that's the most important thing, is the integrity. And we're the face of Lilly. So that's one of the things. And also, I just wanted to mention something else. Even though you can start in sales, there's one key thing. You have to drive your career. If you're thinking about going into something else, you have to have those sit-down conversations with your manager or any mentors to make sure that, you know what, if I decide I want to do something else, even if it's not Lilly, if it's another company, if any other company, you drive your career. You're the one that have to look into any other positions. Once you look into those positions, find the qualities, the skill set, and drive it, because no one is not going to drive it but you. So that's what I wanted to mention.
You know, to all three of you, it's amazing to listen to your passion, and but it's so genuine, and and it's authentic, which, when you can bring your most authentic self to your job every single day, isn't that really what it's all about? So thank you. Yeah.
And we had a big push too in the last 2 to 3 years. That has been our goal, to be ourselves, because if you're not yourselves, then you don't bring your ideas, your creativity. And with Lilly, this is what's been true to for the past 3 years. This is what we've been focused on. Be yourself, because you know what? When you're yourself, creativity flows, the business will thrive, and we will thrive. So that's our culture also.
Well, I think, yes, Mick, hands down, yes. So, you know what? I think we could go on and have a lovely conversation for the remainder of the afternoon, but in respect of everyone's time and energy, I just think that what you all presented here today is fabulous. And thank you so much. I appreciate your time, and I know that our students appreciate it. And let's hope that perhaps the fall semester will bring us together in a different spirit. So there we go. Until then, enjoy your virtual selves, and be well and stay healthy. Thank you so much, everyone.
And I will follow up with you guys on the tracking.
Yeah.
All right. Yes, most definitely. I appreciate it. Thank you so much.
Thank you.
Thank you, everyone. Thank you.
All righty.
Bye-bye.
Bye.
Mick, you know what?
Yes.
You hung in there, and Parker didn't even.
I did.
A peep. Not even a peep.
I did. Not even a peep. Luckily, my wife stopped in, grabbed him, and went outside with him.
Oh my goodness. Oh my goodness. Gosh. Well, this all worked out. Yeah.
Absolutely, it did.
So, yes. All right. Well, I have another student at 5 o'clock, so off I go. Kath, take care. Nolan,
take care.
And
Nolan.
Speak soon. Bye.
Have a good one, everyone. Bye-bye.
Thanks
See you
again.
tomorrow. Bye-bye. Thank you.
Bye.